A hearty good afternoon and welcome to a session on managing children with diarrhea. We're glad to have Dr. Susanta K Badatya among us today to help us understand this topic. Diarrhea is common during the monsoon season, but it should be taken seriously. It's also important to understand that when to seek help, because diarrhea can lead to dehydration and even more serious conditions. So we encourage our audience to speak up, do not hesitate, and ask questions to clear doubts or anything more with the doctor. So, doctor, you have the stage.
Okay, thank you. Thank you for the opportunity. In this Facebook live session, we will be discussing the management of children with diarrhea. What parents need to know so that they can be aware of the situation and they can reach out the facility accordingly timely. So, first of all, we should know what is diarrhea. So, most of parents get confused whether the increased frequency or increase in the wateriness is diarrhea. So, most consistent definition should be that any recent change in consistency or frequency of stool, we should take it as a diarrhea. So, what that mean? As stool frequency may vary from with the range with age. The frequency of stool should be according to the age. So in first few months, the frequency of stool may be even 10 to 12 times per day. So every time baby passes stool, it may not be a situation like diarrhea. So and this is also important that the consistency, which was if earlier was form stool, and any change in recent consistency like it becomes watery, so that marks any onset of diarrhea episodes. So first we should be aware of the number of stool baby is expected to pass in a day. So more the younger the baby is, the more frequent the stool passes will be. So within first 1 month, the stool may range from even 10 to 12 times per day. On average, it will be 5 to 6 times per day, and in subsequent months, it will be around 3 to 4 times a day. And by when the baby reaches by 1 year, then it becomes 1 to 2 per day. So it may even also happen that baby may is passing stool every 5 to 7 days. If particularly in the breastfed babies, that is also normal. So the main important point is the consistency should be changing in presence of diarrhea. Even if baby is passing well-formed stools multiple times, it may not be diarrhea unless the stool pattern or characteristics are different from earlier points. So what should not be considered as diarrhea, that is also important, so that parents should not be worried unnecessarily. So first, frequent passage of form stools is not to be taken as diarrhea. Second, as we have discussed, in newborn babies, like first after first passage of meconium, subsequent from day 3 to day 7 of life, the baby undergoes changes in the body that results in formation of transitional stool. What is that? There is a process of messy, yellowish greenish color stool that may be bit of watery, bit of stool in that. That is called transitional stool, but it may be also at a frequency of 10 to 12 times, or after each feed, baby may pass the stool. But if baby is not having any other symptom like decreased feeding or dehydration or decreased urine output or any abdominal symptoms, then it should not be considered diarrhea. This is called transmission stool. It's absolutely normal. And during your first visit, you can get checked up with the pediatrician to ensure that baby is well. So this is not a case of diarrhea. Second, in breastfed babies, another phenomenon happens that is called gastroclear reflex. So if, during feeding or soon after the feeding, baby may pass bit of watery stool soon after feeding. So as breast milk is known as a natural laxative. The sugars in it cause the stool to be bit flowy. So these are not diarrhea. The frequency may range from 10 to 15 times a day also. So it is very important to have a as a over you have to have a wholesome view of the baby. So to have a very good feeding activity, baby is passing urine, there is no fever, there is no fussiness, this baby doesn't look dehydrated, so we will take it as a normal thing. If baby is passing large stools with each passage of stool, baby is not passing urine, and baby is not accepting feed, then definitely this is not a normal episode. You should get examined by the pediatrician to assess the weight, to examine the baby. So these are the cases where you need to seek the medical expert opinion. So to be sure that it's not a diarrhea. What things are not normal? If baby is having fever, then it is not the it shouldn't be taken as a normal stool or like that. So if there is presence of fever, is there is presence of pain abdomen, or there is any discomfort while passing stool, or and there is a swelling of abdomen. So these are the organic signs, or that indicates that the passage of stool, even if it's bit change in frequency or bit change of consistency, so these are not normal. So what are the reason of diarrhea? So most common thing we encounter in first 2 years of life is the infection related diarrhea. So first and foremost condition is in our country or our setup is the infection. So most of time it is the viral infections that cause the episode of diarrhea. But in addition to the virus infections, some bacterial and parasitic regions are there to cause diarrhea. So most of time, the route of entry of the infectious agent is the oral route. So poor hand hygiene, unclean food container like the bottles. If we are using a bottle feed, the bottle unclean bottle and unsanitized bottles, the utensils we are using for to prepare food, that is not cleaned properly, and it's the street foods where the hygiene is not ensured. So these are things let the germ to entry into the oral cavity, and through via that baby gets the infection. Some in general, some viral infections, like even a respiratory illness, may cause diarrhea, vomiting in a baby. So most of times, it's the fecal route of the where the infection gets into the body. Second is the indigestion or food poisoning. If we were giving babies have taken some spoiled food or some improperly cooked food, then it may result in diarrhea, but that should be a transient till the baby is get rid of the improperly digested food in the body. Third is the intolerance to the food components, like baby is getting lactose intolerant or gluten intolerant. If baby is getting those food materials in his diet, then it may result in a presence of loose stools. And some allergy to food or some drug-induced diarrhea also we encounter in a practice. But majority of time, it is the infection that is the reason of the diarrhea. And moreover, if there is presence of fever, then it is almost certain that is the result of infection that is causing the diarrhea. So uh, what is the treatment of the diarrhea? So we know that is the most of time it is a viral. As per the etiology, the treatment exists, and most of time it is a viral infection. So the causative agent has no cure itself. So with time only, as the body fights out with the virus, then it will settle on its own. So most of the time it is self-limiting illness, and but we need to take care of the body for the ill effects of the diarrheal effect. So first and foremost thing is the maintenance of hydration. And for hydration, you should know that within first few months, like first 3 months, if there is presence of diarrhea, then we take it as a signs of any underlying illness that is more hazardous to the life of the baby. So within first month of life at least, there is no home treatment of diarrhea. You should reach out the health facility for assessment, and to see if the baby is having some serious illness or serious bacterial illness, so that it can be managed accordingly. And most of the time, the fluid management is also becomes important in this age group. As baby becomes very lethargic or has a poor intake, then the hydration maintenance part becomes very difficult. So it baby may need intravenous fluid replacement and or intravenous medications. So first month becomes very crucial. So first, to identify if the baby is having diarrhea. Second, if baby is having diarrhea, baby is having an associated serious bacterial infections. So first month home management is very restricted practice. So it should be after only, it should be only after the physician gets the evaluation. Subsequent months, home management exists, and it should be mainly focused on the hydration. Parents often be distressed about the frequency of motions, and they get always the idea that some medications I must get to stop the motions. As we know that this region is the virus infection. So most of the time, even if we use many medications or antibiotic or like that, it is going to not affect the duration or severity of the diarrhea. So first foremost, the hydration maintenance is important. If you are sure that baby is not hydrated, so then you can continue the hydration part with the ORS or homemade ORS or some ORS equivalent fluids like rice or pulses based drinks like dal, rice water, dal water, vegetable soups, yogurt drink, or sikanji, lassi, buttermilk, where there is a water, there is sugar, and some salt added to it. So even coconut water is also good replacement. But first 6 months, we always advise breast milk and ORS if needed. And for 6 months onwards, all these things I have mentioned, these becomes appropriate. So first 6 months, we should not stop milk intake uh, per se, because milk intake itself is necessary to maintain the nutrition and the hydration part also. So first is the hydration maintenance. So whatever baby is passing in the stool should be replaced orally, unless it is very high purge rate, like 15 to 20 times a day, where we are not expecting baby to have the same energy to drink this much of water, where IV replacement becomes necessary. This oral replacement of fluid should be sufficient for the duration. Usual duration when the diarrhea starts to decrease is 5 to 7 days. After 5 to 7 days period, the frequency and the severity gradually decreases as the body overcomes the viral replications. So we should not focus to stop the motions, as the medications we advise in adults to stop the stools may result in the toxic megacolon like syndromes that becomes so of the abdomen. So first and foremost, we should not be aiming to stop the motions immediately, but the hydration part maintenance is the important. Second, the most commonly used drug is the zinc replacement, zinc supplement. So zinc is has been shown to reduce the severity and duration of the diarrhea, but it does not stop immediately. So duration of the zinc supplement should be 10 to 14 days at least. Even after the baby has stopped passing stool, it should be replaced for 14 days. So that it is shown that if baby is replaced, the zinc course is finished, completed, then subsequent 3 months, baby is also getting protection from the subsequent episode of diarrhea. So the zinc duration should be finished. Third, some of the pediatricians use probiotics to counter the ill effects of virus in the gut. So probiotics you may be prescribed by the physician, and you have to take the probiotic for 5 days, 7 days according to the prescription. In first month, the examination is important. So these home remedies you can repeat in subsequent episodes of diarrhea, but first you should be ensuring that you are in touch with the radiation. First get examined, and subsequent days you can continue with the same medications. Second thing, that role of diet during diarrhea becomes very important, because during viral infection, baby has lost its appetite. So baby is not expected, or baby is not going to have a same quantity or type of intake where it was prior to the illness. So babies should be offered plenty of fluids, so that that contains the sugar and salt in it, not plain water itself, so that baby is able to maintain its hydration along with the energy part. And in addition, the meals should be given more frequently and small amount. For 6 months, the breast milk should be continued. That is the nutrition part we are dealing with. And first 6 months onwards, whatever meal baby is taking, that can be split into the small portions, so that baby is able to take it, and that also reduce the risk of vomiting. Babies often forced into take the same amount of milk, and baby vomit it out. So that is results becomes zero. So the things which are easily digestible. So home prepared foods, and the more the it is less spicy, that becomes very easy to digest. And fruits like banana you can offer, so that they are more rich in electrolytes and energy. So that helps in the recovery part also. And as far as antibiotics are concerned, what is the role of antibiotic? So antibiotics are used very specifically for few conditions during diarrhea, so that should be left to the clinician's discretion, and it should not be overused. And no, should not be no self medications. Like last time, baby had similar episode of diarrhea, baby recovered with the antibiotic. Let's start with the same in the first day itself, so that baby is not going to suffer for 5 to 7 days. So this over use of antibiotic sometimes may lead to prolongation of diarrhea also, and it will be a factor for development of antibiotic resistance also. So subsequently, whenever baby is going to need the real use of antibiotic, then baby may not respond to it. So things parents should keep in mind, that dangerous signs associated with diarrhea, where baby should be taken into the health facility, not always keep the baby with you, and just seek telephonic advice for the management. Like the conditions where you are not sure that baby is getting dehydrated, like baby having shrunken eyes, dry lips, poor skin texture, or decreasing urine output, that becomes that condition where should not be kept in the baby. Baby should not be kept in the home at least. Second, presence of blood in the stool, where baby should get examined, and antibiotic accordingly. Sometimes some surgical conditions like into substitution may present with the bloody stools, and baby other and abdomen distension, or abdominal cramps, so that parents get distracted that this is another episode of diarrhea, let's manage with the antibiotic. So that becomes very hazardous for the baby. So any blood and stool should be checked with the pediatrician. High purge rate, like baby is passing 15-20 times a day, then baby may severely get dehydrated if for even for a period of 6 to 7 hours baby is not getting any oral intake, then baby may slip into that severe dehydration, and that will may affect the kidney also. So the high birth rate cases we should be kept in the observation system. Third, any diarrhea that is persisting or prolonging beyond 14 days. So that becomes a definition of persistent diarrhea, where we doubt presence of some infection or some allergy conditions or presence of lactose intolerance, where the specific management comes into the play. So these are the things where we should be seeking the medical care. And during diarrhea, we should be concerned about the dietary management, as we are discussing earlier, and we should be avoiding giving the carbonated waters like soda, lime soda. So parents often have an idea that giving these things help in digestion and they will improve the diarrheal episodes. But carbonated drinks we should avoid. Caffeinated drinks also, tea, coffee, we should avoid, as this may stimulate the gut and may increase the loose motions. And even the caffeinated drinks may induce the increase in urine output. So that in addition will cause dehydration the baby. So first, don't give caffeinated drinks. No street food during diarrheal episodes, even if baby is fond of taking those things. So you should be avoiding the street foods. Processed foods also, like the packaged juices. So these are acidic and have a preservative, so they may cause vomiting. So and that will that some processed fruits also have high content of salts. So the during diarrhea episode we are bound to replace water, salt, and sugar. So only one component if you are giving in excess, then that may lead to disequilibrium of the salt in the body. So as a whole, you should restrict the food intake into the simple foods, homemade foods, and as a whole, fluid replacement becomes center in the diarrheal management. Some myths associated with the diarrheal episodes, like the baby who are around 5 to 6 months getting the first episode of diarrhea or subsequent years. Parents often think that teething is causing diarrhea. We need not treat it with medications or with the fluids. It is bound to happen. But it is known fact that teething has no relation with diarrhea directly. During teething, as baby is putting everything in the mouth, if the unhygienic things go into the mouth, then diarrhea may happen. And if that is happening, then teething is not reason. The infection that is baby has acquired via this mouthing pattern, then the diarrhea has happened. So that management should remain same: fluid, zinc, and the danger sign observation, so that the management is not faulty. Second, many times parents often stop the milk intake during diarrhea. So first 6 months we should not stop the milk intake. It is the main source of nutrition in the baby. Subsequently also, not every case of diarrhea needs the stoppage of milk. So it should not be generalized. Only those cases of where the diarrhea gets persisted, like more than 14 days, some dietary modifications like reducing the quantity of milk in diet may have advantage to counter the lactose intolerance part in the baby, but should be in consultation with the pediatrician only. Third, presence of color or smell has no role in diagnosis of diarrhea. So often parents complain that my baby is passing green stools, but the color part is not going to have an impact during severity or diagnosis of the diarrhea, except it is bloody or there's some mucus stools is there, then it indicates presence of dysentery. That part needs antibiotic and it should be managed with a pediatrician. So second concern parents often ask at how to prevent recurrent episodes of diarrhea. First and foremost, the baby should be getting all foods with hygiene. So hygiene maintenance is the first cornerstone of the management of prevention of diarrhea. Second, nutrition. Well nourished baby are less prone for diarrhea. So baby should be nourished well. They should be checked if there is baby getting malnourished or the growth is falling on centiles. So that nutrition management is important. Third, vaccinations like rotavirus vaccination, measles vaccination in 9 months. These vaccinations help in management of the diarrheal disease causing agents. Third, avoid misuse of our medications like antibiotics. Third, avoid sugary drinks much, because in some babies we notice that presence of excessive sugars may lead to presence of watery stools in the baby. So avoid sugar drinks. So concluding the session, we should know the what we should do in diarrhea. First, give ORS or plenty of fruits, like homemade. If there is not taking ORS or not liking the flavor of it, then you can use the suitably homely available fluids to prevent dehydration. Second, continue breastfeeding. Whatever amount baby is taking it after each stool, you should replace with the ORS in addition. And sanitation and hygiene maintenance is the another part. And complete the full course of that zinc, not that you are stopping after the motions get improved. So complete the 14 days of zinc as doctors have prescribed. And if baby stool is showing some mucus of blood, then you should promptly contact your doctor. According to the doctor will assess and advise the stool test or ultrasound abdomen or antibiotic accordingly. What we should not do during diarrhea? First, don't starve the baby, thinking that baby is not able to digest, and without giving food, baby stool will decrease. So baby's body is expected to receive energy. So small and frequent portion of meal you should offer the baby. Whatever is taking, this is good, and the rest should be taken care of by the fluids we are taking. And no misuse of antibiotic should be there, except ORS and zinc and probiotic and the fluids. No other medications should be taken on its own. And the unsuitable fluids like the sugar or the glucose solutions and fruit juices should not be used. Only the ORS or the ORS equivalent fluids, as we have discussed, should be given. No breastfeeding shouldn't be stopped during diarrhea. And if baby becomes dehydrated or not looking good at least, then should not be kept in the home for prolonged time. So these are things we should be aware of during an episode of diarrhea or preventive diarrhea. If there is any questions in the audience, we can take that for discussion. Okay, I think there is no questions, so we can conclude the sessions. Thank you.